I'm Christine Buck, and I'm the Program Coordinator of the Community Health Resource Center at UVM Medical Center. I also coordinate the HealthSource Community Education Series. It's been a historic and challenging year due to the COVID-19 pandemic, and our new ways of working and meeting have changed. This is why we're now offering our free community health education online, and we hope that you'll enjoy this new virtual format. By offering virtual classes, we can now welcome participants from the entire UVM Health Network region of Vermont and Northern New York. So before we get started, I just wanted to review a few items. This session is going to be recorded and all attendees are muted. If you'd like to engage with our presenters, please use the question and answer box. It's on the upper right-hand side of your screen, and it looks like two little flags with a question mark. And we'll try to answer as many questions as we can during the presentation, and then also towards the end. Also, we will be sending you an email in a couple of days with a survey, the class slides, and a recording. So keep your eyes open for that, and we really do appreciate your feedback. So tonight we're joined by a multidisciplinary panel of experts. Lisa Hoare is UVM Medical Center's garden educator. Michael Atray is a primary care physician at UVM Medical Center's Given Adult Primary Care, and Michelle Gates is the executive director of the Vermont Community Garden Network. So I'd like to now welcome Michelle, and she's going to kick off our panel this evening. Thank you.
Thank you. We are very pleased to be here to talk about our new Gardening for Health program that we piloted at the University of Vermont Medical Center main campus on the existing rooftop garden this past summer. This is a program that's been in the makes, I guess, for a couple of years now. And so we were really pleased to sort of kick it off. We did have a few stumbling blocks, as you can imagine, with COVID-19 this year, but I think that we managed to work around those a little bit. So we are very pleased to share some of the things that we learned. I'm going to go ahead and just give you a brief outline.
Nancy, try clicking on it with the mouse, like moving the mouse over that screen, like all the way over on the presentation. Like the mouse will go over the other.
It's on there.
It is. Okay. Oh yeah.
Okay, so here we go. Sorry, technical glitches. So today we're going to talk a little bit about the program overview. So sort of what our intentions were, what we were trying to provide to people. We are going to talk a little bit about the challenges and some of the adjustments that we made because of the pandemic. Then we want to talk a little bit about the actual program. How we delivered the program, who was involved, some of the lessons, an example of what we taught, and that kind of thing. We'll go through some outcomes, specifically in terms of how many people participated in the program, what we grew. We'll talk a little bit about outcomes that we're still waiting to get back from in some of our surveys. And then we'll talk a little bit about lessons learned and next steps. So the things that that maybe we could make some adjustments on, things that could change for next year, depending on the responses that we got from participants and things like that. And as was mentioned, if you have questions as we're going along, feel free to type them into that box there, and we can try to answer them as we go along. And if you think of something later on, we'll have some time at the end of this discussion, and we can also answer questions via email afterwards. So before we really get started, we really do need to make sure that we thank the University of Vermont Medical Center Foundation. We absolutely would not have been able to provide this program without their support, and so we actually applied for a grant through the UVMMC fund. We met with a group of their foundation representatives to talk about the program. We were approved for this pilot program. It is a pilot program, so we have funding for 1 year. Because of the pandemic, we're able to sort of stretch that over to 2 years. but that's, you know, a pilot program is something that a funder will give you sort of some starting seed money to get off the ground. It's not necessarily intended to sustain the program, so we will be sort of looking at ways to scale this program and then find funding to keep it going for years to come. So a little background, I guess, on how this program came to be. I work for the Vermont Community Garden Network. Most of our work is centered around supporting gardens for community and individual wellness, because we know that gardens offer much more than just nutritional benefits from eating healthy produce. There's physical benefits of actually the, you know, kind of the work that you do in the garden itself. If you're eating a whole foods diet, there is you know, weight loss and improved muscle mass benefits that you get. There's also a lot of psychological benefits from gardening. Many new gardeners found that out this year. It's really a way to kind of reduce your stress, getting your hands in the dirt, just being calm, being connected to the environment, and then obviously the nutritional benefits. So we know this. We do a lot of work with schools in trying to sort of connect children to these benefits before, you know, in schools. We do a lot of work with even with senior centers. We do work with housing, affordable housing sites to get residents to be able to have some support in gardening. And so we know that these benefits are out there. We, you know, really wanted to make sure that, well, I guess I wanted to just talk about how the program started. So Dr. Latreille, who will speak a little bit later on, and I were actually kind of brainstorming a little bit about how to sort of introduce these benefits to folks that might have chronic conditions and could really benefit from this type of intervention, more than just with the food that they're eating, but all these other benefits as well. And we were talking about shared medical appointments, and he was working on one with culinary medicine, and kind of doing some recipe demonstrations and talking about health benefits and nutritional education. And I said, well, gosh, what's one step, you know, removed from that is getting people to actually grow their own food. So so it's just, you know, you don't have to grow all of your own food, but we have seen a lot of interest in people, even if they just start out by growing one pot of tomatoes. It really can lead to a real interest, a lifelong interest in not only gardening, but eating healthier food, eating local food, and buying things from the farmer's market, and just an appreciation of where your food comes from. So that was important to us. So, our overview. What did we decide we needed to do? We proposed an 8-week introductory garden program. We really wanted to reach people that hadn't gardened before. I had never gardened until about 10 years ago, and I can tell you it can be intimidating if you have never done it before and you really want to have somebody. And so you're going to make an investment of your time, and in some cases resources and money. You want to make sure that that there's some support for new people, and they feel that there's something that they're going to you know, have success at. We chose 8 weeks because we wanted to make sure that there was enough time to see sort of the fruits of your labor. So we knew that we were going to have we wanted to show people how to plant seeds, and we chose a vegetable that would grow quickly, but we wanted to make sure that the harvest would be there for people when they, so that they could take those things home. We originally planned to do 2 sets of workshops, one in June and one in June to July and August to September. We did delay the June-July one, so our program ran from the beginning of August to the end of September. We knew that it was really important to make sure that we weren't just including gardening education, because we saw this as a comprehensive wellness program. You know, when we talk about all the benefits of gardening, we know that physical activity is really important. But we also wanted to include things like, you know, some healthy eating, not just nutrition, but really thinking about healthy eating and how you can incorporate those habits into all of the meals that you eat. And mindfulness was important to us as well, because we know sometimes people just eat, you know, when they're not paying attention. Maybe we want to make sure that eating and healthy foods are really something that you're intentional about. Mindfulness also is something to, especially in these days, I think kind of ground people, really get in touch with who you are and what you're wanting. So that was important for us to include those things as well. We did need to create a target audience. Initially and throughout the whole process, we were really interested in seeing what the effects of incorporating gardening and whole food eating would be on folks with chronic conditions. We do believe that if people moved differently and ate differently, then a lot of chronic conditions could be reduced in people. So we intentionally targeted people with diabetes, prediabetes, or had some associated risk factors for developing those conditions. We also, because the pilot program was funded by the UVM Medical Center Foundation, we thought it was important to limit the participation to people that had some sort of care at UVMMC, and that includes employees that would also have some of these conditions. You know, I'm gonna turn it over to Lisa for a minute, but I think, you know, when we talk about kind of what the workshops needed to include, we really were wanting to make sure that these groups were able to interact with each other. So we made sure to include sort of icebreakers, sharing stories, helping people like talk to each other in these small group settings. We had 14 people in each setting. We included stretching, so that we were not just telling people about the physical components of gardening, but actively making sure that there was a sort of a routine that they could learn and then hopefully take on and do at home as well. And then we wanted to make sure that we were really modeling how to use vegetables. So we'll talk a little bit in a few minutes about what that looks like, but we made sure that we were doing some demonstrations and really focusing on incorporating fresh vegetables easy for people, and not, you know, something that just something that anybody could do. And then talked a lot, obviously, about the mental health benefits of gardening that many people know about if you've spent some time in the garden. So I am going to turn it over to Lisa for the next couple of slides, and then I'll be back in a few minutes.
Hi everyone, and thanks Michelle. Yeah, so as Michelle mentioned already, we did originally plan on having the 2 8-week sessions, the first one being June, July of 2020, and the second one August and September, and we did have to postpone. It was a difficult decision, but certainly, you know, as we all were becoming more and more aware of the seriousness of the pandemic, we did make that decision to go ahead and postpone, and we're able to move that to June, July of 2021. So this actually turned out to be okay, as we decided in hindsight. There were a few silver linings to that. It did provide us with some additional time to make appropriate adjustments, and also to let our community sort of get better acquainted with the health and safety protocols that have become our new normal. So we did make a few important changes to the program. I think Michelle did mention that originally we had planned to have 4 groups of 20 in each of those 2 8-week sessions. We did reduce our class size from originally 20 down to 14. That allowed for physical distancing in the garden. We also originally planned for participants to sort of garden more like shoulder to shoulder, and we'd be sort of planting seedlings and seeds sort of all at the same time. When the pandemic set in, one of the things that we changed was establishing designated gardening areas for each person, which we ended up enjoying better anyway, because people were really able to keep track of the growth process as things went along. So that was really nice, but was a big change, and you'll actually be able to see that in a couple of the slides coming up. We have some sort of photo collages that will give you a sense of what the garden really looked like, and you'll be able to see in there how we sort of demarcated each of the gardening spaces with some red twine, and that allowed us to keep the group separate and also the people within the groups separate. So everybody was, you guys, so everybody was able to keep about 6 feet apart from their nearest neighbor. And this also reduced size allowed us to physical distance in the seating area of the garden as well. So a couple of other adjustments that we made, we were able to supply each gardener with their own set of gloves so that we weren't sharing gloves. And then all of the tools that were shared were sanitized in between sessions, along with other things such as like the hoses and handles and other areas throughout the garden that might have had multiple touch points. And then, you know, as I mentioned, a couple of silver linings that came into play. As one of you, or maybe many of you, if you're participating in this presentation, you might already have an interest in gardening. So you might remember that back in the spring, there was actually quite a big upsurge in interest in gardening. So we felt that definitely really benefited us as far as being able to recruit people for this pilot program. So that really worked in our favor. You know, people, I think, a lot of people became more interested in where their food was coming from, and also a lot of people had more time on their hands, so gardening was a safe activity that they could learn and practice at home. Also, you know, certainly Michelle touched on this a bit too, but local food and growing your own, you know, something that you can, it helps you avoid trips to the grocery store, which also became you know, important, especially at the early stages of the pandemic. So that was definitely a silver lining for us. Another main benefit to postponing is that we were able to obtain greater participation from several students that helped us with both notebook content and you know, content for the program in general. So there were 4 medical students that worked with us on all the content from the physical activity portions and the nutrition portions. We also had 1 graduate from the UVM dietetics program that worked with us as well. And you know, this, we feel in hindsight, really enriched the program. So we're very grateful for that participation that we wouldn't have had if we had not been able to postpone that, you know, the first 2 months. So those were all good things as it turned out. So recruitment and promotion was really a fairly multi-pronged approach. Definitely there were a few changes that happened. Many of, you know, we had certainly intended to recruit and enroll from primary care sites, family medicine sites, and subspecialty clinics. During the first few months of the spring, a lot of those areas were actually closed. So we did receive a lot of help from our talented friends in marketing to help expand our recruitment efforts. We employed in-network channels such as using the employee intranet page and employee wellness and Facebook pages. We also worked outside of that and sent out some press releases and had a lot of hits from the Facebook page as well. And it all worked because we ended up filling up right before the program started. So we felt pretty happy with that. And then, yeah, the marketing team also did help us create a web page on the website. You can see that listed down here at the bottom, and there's also an active link that will be embedded in this when you receive that as a PDF. And that will be the same spot that we enroll from for the spring session as well. Let's see. So it's sort of a nice photo here of the rooftop garden. This is where everything, pretty much everything happened. We have, you can see how most of the actual didactic portion of the sessions and then most of the recipe demonstrations were all done under the pergola there on the left-hand side with the seating areas, and then all the hands-on gardening happened in those beautiful raised beds you see off to the right. So as I mentioned, we sort of split those up into 14 different spaces for each group, and that turned out to work really beautifully. You'll see in a couple photos coming up, we planted some seedlings and some seeds, and it actually was a nice little collage there of vegetables growing. Groups 1 and 2 met on site on Tuesdays from 5 to 7 p.m. and groups 2 and 4 were on site on Thursdays from 9 to 11. And so they alternated on-site workshops, filling in those off weeks with at-home activities. The gardening, we were able to fit quite a bit of gardening instruction in there. As it turned out, there were only 4 on-sites, but you can see we really covered quite a comprehensive list of topics here. So we were, pleased with how that went. Let's see, after, we packed quite a bit into each session, but always had some time for sharing stories. There were actually a lot of people that maybe had just started gardens at home, keeping in mind that this 1 8-week session didn't start actually until August. So there were a few people that had joined the session that had gardens already started at home. So it was really fun for them to be able to come in and actually share some real-time gardening challenges that they were having, and we were able to address those right on site, which is always a learning experience for everybody. So for me, that was probably one of the most gratifying parts, was being able to help people right then and there with some of their existing gardening questions. And so that was great. And let's see, although also and actually I'll just talk about these, I guess, real quick. We've put up a couple examples of some of the weekly workshops that were, listed out here. You can see that, for example, week 1, we start everyone with a sort of a gentle stretching routine. We go into then a mindfulness exercise, cover a whole list of gardening basics. We go out into the garden and practice the hands-on activity, and then we finish out each workshop with a nutrition lesson covered by a registered dietitian here from the hospital, along with a recipe sample. And so then then participants were given a gardening activity to take home with them. For example, the first week they were given, we planted seedlings in the garden, and then everybody was given a 4-inch potted herb that they brought home with them and potted at home in a pot with some soil that we supplied as well. So the at-home activity sort of mirrored reinforced rather what they had just learned the week before in the garden. So just to give you a couple ideas of things we did there. And I'll pass it back over to Michelle. She's going to talk about these photos a little bit.
Sorry about the back and forth a little bit. Normally we'd all be up here in a panel, but you know how things are now. So here's just a picture. Sometimes it can give you a little bit better idea of what kind of it looked like up there. These pictures show nice sunny days, which most days it was. But you can see on the top left picture, that's a planting demonstration. So Lisa's there at that first box showing folks, what we were going to do as the gardening activity. And people were really respectful of the kind of the guidelines from our state and the CDC. So people are standing apart from each other and wearing their masks and all being very attentive. The next picture, so over here on the top right, you can see sort of a little close-up demonstration. The tiny little plants on the right are spinach seed, and we planted those by seeds. And then the leaves on the left belong to a chard plant, which we planted as a seedling. We wanted to give people both experiences, keeping also in mind that this was an 8-week program, as I mentioned before, so we wanted to make sure that things grew in time for people to take them home. And then, let's see, Again, bottom left-hand side is people getting ready to harvest and take some of their produce home. I think one lesson learned that we actually didn't think about before was having people bring their own baskets and things like that to take their harvest home, because we did end up with, you'll see in a couple of slides, we did with quite a bit of produce that people were taking home. And then there's another just really pretty shot of that's some red oak leaf lettuce and some radishes that are growing in those boxes. And because we originally intended to have 20 people and we ended up with 14, we did have some boxes that were not being tended to by a participant. We also planted those because we just wanted to make sure we were taking advantage of all of the space. And we wanted to make sure that there was produce for people if for some reason there's been a grow. And then we'll get into what we did with all that produce in a few minutes. So materials provided, and again, I'll just throw out that we're really grateful to the foundation for providing this. I don't think we've said this anywhere, but this program was actually free for all the participants. It wasn't free to provide, obviously, but no one had to pay to take the program. And then we did make sure that we were giving people all the supplies and materials that we felt they would need, not only to be successful for this 8-week program, but to hopefully continue their gardening careers. So those included a course notebook that Lisa mentioned before. We had a lot of help putting this together with some med students, but it's a very comprehensive publication. It's over 60 pages of all the gardening instruction that we provided and more. There are pictures of every bug you would probably encounter in the garden. There's a whole section on how to can things. So we really felt like we wanted to give everybody a really nice sense of kind of every kind of all the curriculum that we were covering in the class, so that they could go back. If you've ever taken a gardening course, and I've taken a couple, you think you're going to remember everything, and then you go home and you need to look it up again. So we wanted to make sure that people would feel equipped to do that. We also provided some really useful links and that kind of information so that people could look things up too if they needed to. Also in the gardening notebook was the stretching routine, and all of the recipes that we demonstrated plus more are in that book as well. We gave them the supplies that they needed to do all the at-home activities, which Lisa mentioned. She mentioned the herbs. The next at-home activity was planting pea shoots. So we provided, again, the soil and the pea shoots that people would need with a planting container for them to do that. 1 week we were ambitious and we did 2 tasting demonstrations. One was to make hummus in the garden, and we also did a small canning demonstration out in the garden so people could see just sort of how accessible canning is. I mean, I think it can be scary for people if they've never tried it before. So we really wanted to give people a taste of not only now that you're growing all these vegetables, what do you do with them and how can you preserve them? In order to keep people engaged and to hopefully encourage them to do their at-home activities, we also sent weekly emails with course reminders and then just different links and helpful tips for people along the way. Another thing that we did provide to people, which I consider a pretty big success actually, is the first day of the class we gave everybody water bottles. And we every week when we were having the classes at the garden, we made sure to provide a different flavored water so that people could get used to maybe switching out of soda and sugary drinks and drinking water flavored with mint or flavored with apple or flavored with watermelon. And those were really popular, and several people did say that gave them sort of an incentive and some ideas to start drinking water instead of soda. So we consider that a big success.
Michelle, it's Christine. Before you move on to the next slide, we did have a question come in. Someone was wondering, aside from what we could see in the photo couple of slides ago of what vegetables were growing in the garden, do you have a list of other vegetables like a total list of vegetables? And then, they were wondering if there was any particular vegetable that people seem to enjoy the most, or any consensus on that?
Sure. So in the student beds, we grew radishes, spinach, Swiss chard, and several different types of lettuce. Red oak leaf, green oak leaf, and then a butter lettuce, which was really popular. We also used the rest of, there were several communal beds, so we were already growing cucumbers and tomatoes and squash and peas and carrots. I'm going to forget something. The other thing that was really actually popular for people was to take to be able to access the herbs and some of the culinary flowers that were being grown and kind of what to do with those things. So we made sure that we did, we sort of pointed out things that could be included in salads, just pretty edibles that that people liked. So borage was one I think that people had never, a lot of people were unfamiliar with. In terms of a favorite vegetable, people were just thrilled to bring home all of the things. Like I mentioned before, butter lettuce was really popular, and our heads of lettuce got ginormous. I wish my garden cooperated as much as this garden did at home. But people really appreciated having those. And just having, we got many comments when they were bringing things home. Oh, great, I'm going to go home right now and make a salad out of all these things. And Lisa passed me, so let me just make sure. I think I got everything. Squash, herbs, sweet potatoes, cabbages, yes.
Thanks,
sure. So in terms of healthy eating topics, we covered kind of the gardening topics, but again, you can grow all kinds of food, but if you don't know what to do with it, it can be a waste, or it can be a little scary if you're not used to cooking with some of these things. So we really wanted to make sure we were giving demonstrations and tastes of things that were accessible, not some bizarre exotic thing that nobody had ever heard of, or that you needed ingredients that nobody had in their pantries. There's a picture there of Gretchen, who is the registered dietitian that worked with us. She really had a really nice approach. You can see this little quote that we have on here. She focused on this a lot. What can you add in as opposed to what do you have to take away? So that prompted lots of discussions. I was really pleased with the kind of back and forth that all the participants had on offering suggestions and ideas, their favorites, and that kind of thing. And then, of course, you can kind of see in the background there, we did do cooking and assembling of recipes right in front of people. I think that one of the most popular ones was this building a better salad. People, well, my family always tells me that when somebody else makes a salad, it's always better. But I think that, people were really impressed with just the idea of making sure that you look at textures and layers and have something sweet and something salty and something crunchy. And we did have, a lot of interest in the salad dressing piece. Gretchen really focused on that, about the difference between making your own salad dressing. For health and for economic reasons, it's way more expensive to buy a bottled salad dressing, and they often include things you really just don't need. And it really takes nothing to dump a couple of key ingredients into a mason jar, which is what we did in the garden to demonstrate how easy that was. So here are some of the actual recipe demonstrations that we used. I mentioned the flavored water before, so we always made sure that we had that on site for folks. The very first one we did was actually a little funny, I thought. We brought out a plate for everyone, and on that plate were 2 radishes. One was roasted and one was raw. We asked people to eat the raw radish first, and we had lots of grimaces, and people said, I don't like radishes. And then we had them taste the second one without telling them what it was. And many people said, wow, this is really delicious. What is this? So it was sort of not a trick, but just trying to get people to think a little bit about different ways you can prepare. I will tell you that for the rest of the time, people talked a lot about roasted vegetables. Some people tried it for the first time. Other people were sort of reintroduced to that, or reminded that that was a really good way to eat almost any vegetable can be roasted. We did the mixed salad. That was really popular, and people came back the next week saying they had really taken that to heart and made a lot more salads over the last week. We did a classic hummus. Again, we did this out in the garden. We put everything into a mason jar and had an immersion blender, which we plugged in, and it took about 2 seconds, and people were really pleased with that. I mentioned the canning demonstration just to show folks it was the bath method, so we didn't have to use a pressure cooker or anything. We just boiled the jars. And we did a blueberry chia seed jam, which again, all these recipes are in the notebook that we gave out to people. And then one of the last demonstration we did was just grilled apple slices, just to have people, that was sort of a rethink your dessert session. So we wanted to make sure people knew how wonderful, that you don't need to skip dessert, and that vegetables and fruit can be a really tasty dessert. People were pleased with that. So here's another collage of pictures. The first one up on the left is actually our first class. It happened to occur during a tropical storm. We were able to meet in the garden atrium for the discussion part of the class, and then we encouraged everybody that was willing to come up to the garden, because we had, we only had 4 weeks in the garden, so we wanted to get these seedlings into the ground, and people were really happy to do that. Everybody came up and planted their seedlings quickly. So that's that first week right there when all the garden beds are empty. We're just getting those first little boxes planted. And then the one on the right there is like week 5. So that's how quickly it goes from empty beds to full beds of beautiful lettuce and Swiss chard. And then again, the bottom right picture is just sort of a demonstration of how we had to regroup. We really had intended to do more communal gardening, have people kind of crowded around and planting all different things and the same kinds of things in each boxes, but we had to really measure out, put strings up, make sure that we were spacing people appropriately so that people felt safe and comfortable being in the garden. So these are some of the output that we that came from our gardening program. This is again just for the 1 8-week session. These are the things that we planted in the beds for the participants, and mostly folks planted their own things and then tended to them. We did come in between classes and make sure we watered and did some weeding, so we didn't want that to be a deterrent for people. We estimate that we produced between 500 and 600 pounds of food just in those 21 beds and some of the shared beds in just 8 weeks. So about half of that went home with the participants, and about half of it ended up going to the food shelf, just because people couldn't eat all of the things that they grew. And we hear this a lot, even in a very small, maybe 4 foot by 4 foot bed, you can grow quite a bit of food. We enrolled 59 people, and as you can see from these numbers up on the right, we had almost 90% attendance rate of people that were able to complete the program, so we were really pleased with that. We did expect, and we did get some attrition due to just the pandemic illness, the population that we chose. Everyone in the program did have a chronic condition, so we knew that might present some challenges with people being able to be there on a regular basis. And then just regular things like childcare and transportation always throw some hiccups into participating in a program like this. So I'm going to turn it over to Dr. Latreille to talk about a little bit of the impact that we were able to measure so far.
Okay. Well, thanks for having us tonight. So I'm going to talk a little bit about our plans for measuring impact. And so this is, I'll just sort of start with a caveat that this is all in the works at the moment. We haven't analyzed any of this yet because we're still waiting for some of the data to come in. So, as Michelle and Lisa both mentioned, the idea behind this was really to create a comprehensive health program. And so as part of measuring our impact, it was really important to us that we saw really if we sort of changed behavior. And we had to kind of be realistic about what our expectations were. You know, we talked about measuring sort of downstream impacts of this on health as measured by things like diabetes control and change in weight, et cetera. And really we understand that those things are going to take some time to see some impact. And so what we really wanted to see was behavior change. And again, it sort of comes back to those 4 pillars upon which this program was really based, which, you know, there was the first pillar of gardening education, and then, you know, healthy eating, physical activity, and mindfulness. We administered a pre and post participation survey, which look really pretty similar. We collect demographics and health information in the pre-participation survey, and then in the pre and post, we look at both. We look at quality of life, health habits, and then confidence in gardening and culinary skills. We really want to see if those change. And then so we already administered both of those surveys, and then we have another one that we're going to administer in March, 6 months after the conclusion of the program, to see if, you know, any health habits have changed in a sort of more long-standing or durable way. So, you know, if there were changes in eating patterns, changes in attitudes around physical activity, et cetera, you know, do those actually persist beyond the timing of the program? So as I said, those results are pending in large part because we still have our 6-month survey out there waiting to sort of administer that in a few months. Also, we had planned to analyze, you know, our sort of preliminary from the pre and post, the comparison between the pre and post participants in surveys, but we haven't had a chance to do that, in part because we were kind of set back during the cyber attack, unfortunately. So, you know, just as a kind of, you know, as we sort of look at some of the narrative feedback that we've gotten, and then as we've reevaluated some of the components of our survey, we know already that we want to add some things and change some things for next year's survey. So we really want to add, we actually did not survey people on their attitudes and their knowledge around mindfulness. And again, you know, mindfulness was such an important component of this. We really wanted to introduce people to this concept because it, you know, in the same way that physical activity and healthy eating contribute to an overall sort of picture of well-being, so can mindfulness, not just mentally, but also physically. And so we want to see if this really introduced people to a new practice, perhaps, of mindfulness or meditation, or, you know, if this was their first time ever experiencing this or not. We kind of have some sense of that from the narrative feedback, but, you know, we'd like to really kind of quantify that. We want to add some questions around food security. You know, ideally, gardening is a sort of means of bringing inexpensive and healthy food to the plates of people who cannot necessarily otherwise afford it on a consistent basis. So it's really important for us to know if this reaches anybody with food insecurity issues or not. And then I think we want to get a little bit more specific feedback on some of our home workshops. We want to see, what did people take home? Did they do all the activities that we suggested, or you know, what were the things that were most popular, so that we can kind of adjust for future years. So it's interesting, you know, we put this slide together before we administered the program, and we kind of had hoped that it would have all of these kind of varied impacts. So we kind of looked at this as these kind of numerous components that would interact with each other. So the social connections in the garden, changes in behavior, as I mentioned on the last slide, improvements in health, and then kind of the nutrition support, eating and using more fresh and nutritious components. And so, you know, the interesting thing is that as we look at our kind of narrative feedback, and then, you know, not just in our surveys, but in the kind of feedback that we got from participants during the program, that we didn't even have to change any of these bullets, because we saw that, you know, the participants really kind of got it. They really kind of, I think, took each of these components back in some way, shape, or form. And you'll see that on the next slide. You know, we really saw, from the community perspective, we saw people mentioning that they had met individuals that they would, you know, garden with in the future, and that they were going to stay in touch with. We had people mention that, they were going to grow for themselves and others, you know, promoting healthier families. And of course, we had people mention that they, you know, had changed some of their habits. So we really saw kind of all of this stuff, all of these different components kind of come to fruition, which was really, really great to see. These are some quotes. So these came directly from our program. Before I saw gardening just as a hobby, now I see it as a way to get healthier. I like this second one about sort of the lights going off in my head. I think we had a few participants definitely sort of, this was kind of like a, oh my goodness, I can actually do this. I can grow my own vegetables. And, you know, some of the mention of the tree appreciation, the birds, that was all sort of, you know, part of, those were part of the kind of home exercises that we had people do, that the medical students helped us put together. So I learned so much more than gardening. I think that was great. So we saw a lot of comments like these. So really sort of underscoring that, you know, people really took home what we had hoped to deliver, which is, this isn't just about gardening, this is about your health. So I kind of mentioned a little bit, you know, some of the things that we want to incorporate in the survey for next year. Of course, after a pilot like this, which you could look at this as kind of like a split pilot, we kind of intended to do 16 weeks and we really got to do 8 weeks. The nice thing is, as Lisa and Michelle mentioned, we have quite a lot more time to kind of regroup for our second session, you know, 6 months instead of 1 week. So, you know, there were a lot of things that we learned that we that we'll take to next year. You know, we on the upside, we learned for sure that, you know, people, as I said, they kind of got it. They really understood that the nutrition and the mindfulness were really kind of part and parcel with this. They commented very favorably on it, and I think, you know, that was really good to see. I think we want to definitely better capture the at-home activities, and I think that will come through in our survey. We also have to be mindful of not making the survey overly burdensome. I think we did, you know, again, Michelle mentioned that we lost some participants because of either health, quarantine, because of COVID, et cetera. And I think this kind of underscores that I think we need to enroll more people than we anticipate having in each session so that we can make sure that we kind of get as close to kind of our maximum capacity as possible. And then I think we would just want to make sure that we're targeting the right audience, that we get the right audience into the garden. So, and then there are just some kind of like basic logistical things like looking at parking, our parking plan, noise reduction, because it can be a little bit noisy up there, especially on weekdays. And so perhaps including a weekend class option, not just for the noise, but also because that's the only time that some people can really participate. So these are our next steps, and I'm not sure if I'm supposed to at some point hand it back. Or if I can I'll just sort of move forward, and then when we have questions, I think we can all kind of jump in. But yeah, our next steps, really, we're going to start registering for the June-July sessions, and it's hard to believe that March is only a few months away. But we're going to use the same health criteria, metabolic syndrome, and then we're looking for beginner gardeners, ideally folks who really have no or very little experience gardening, and of course, those who have not participated before, so that we can bring this to a new audience and reach as many people as possible. So these are the links, and these links will be available to you after as well. So there's a link for sign up, and then a link for the email, which goes straight to Lisa. And then we want to give another thank you. So to our funders, of course, again, this would not have been possible without the UVM Medical Center Foundation. To 7 Days for a great write-up, Melissa Passon wrote a great article about our program, and we really appreciate that. We got some excellent photos from their photographer, who did much better than we could with our iPhones and Droids. And then Gretchen, Amanda, who put together the exercise component, which was really great. The medical students who we mentioned, culinary medicine for making the space available. And of course, our participants. Oh, and marketing, we can't forget marketing. You guys were absolutely crucial, and then our participants for taking the plunge with us for this pilot program. And here's kind of a toward the end of the season photo with these huge heads of cabbage that, as Michelle said, are very enviable for anybody who's a gardener. So, and then I think we'll open it up to any questions.
Thank you, Dr. Latre, and thanks, Lisa and Michelle, for that engaging presentation and all the information about the program. If anybody does have any questions right now, please put them up in the Q&A box. If you popped on late, you'll find that in the right-hand corner of your screen, up near the top. It looks like 2 small flags with a question mark.
I'm looking to see if I can see the chat box. Oh, here we go. I can't see if there are any questions, Christine.
Yeah, I was just, we'll give people a minute or two just to see if something jumps to mind.
Sure.
In the meantime, if someone wanted to start their own garden from home for 2021, when would be a good time to start that?
Well, I'm sure Lisa would tell you that it's never too soon to start planning for your 2021 garden. I think it depends on, exactly how you want to approach it. I mean, I think if you're looking at your backyard, there are a lot of things that you can do to prep. I actually just planted garlic, was it yesterday? Yeah, yesterday in my backyard. So if there are certain things that you're going to plant for next year, you have a brief window before the ground freezes pretty hard in the next couple of days. But if you want to prepare for raised beds, you can start looking up designs, and you can look at, there are some local procurers of things like raised bed mix and compost and that sort of thing. So you can really start preparing. You can start thinking about what sorts of things you might want to grow and when you need to start those indoors, because some of those need to get started as soon as like March. And then if you're interested in doing gardening, for example, in a community garden, there are, I think the sign up for that is actually pretty soon in the Vermont Community Garden Network, which I shouldn't comment on this. Michelle's right here. I'm going to let her jump in and answer this.
No, just to add to what Dr. Latre said, it is never too early to start planning for your garden. We actually have quite a few resources on our webpage, which is accessible to everyone. One of them is how to start a garden, and there's many steps that you can kind of go through. So anybody's welcome to look at our website. It's VCGN, Vermont Community Garden Network, but just the acronym .org. So feel free to go there and get some of those lessons.
And I'll just second that, and I'm just sort of sneaking in from the background, but I'll just second that, I had there's like a few years ago, I had a plot over in one of the Vermont Community Garden Network plots, and it was really easy to sort of go online, print the form out and submit it, and I got a plot, and it was very inexpensive. It was something like $30 for the year. And, I got a lot more than $30 worth of produce out of that plot. So, those plots are very well cared for. There's good soil in them. And so it is a great option for folks who don't have space. So if you don't have space, my guess is that you have a community plot somewhere near you.
There are 14 community gardens in Burlington. They're all managed by different folks. So the Burlington ones are managed by Burlington Parks and Rec. So if you go on their website, I believe that they open them to returning gardeners first, and then open them to new gardeners by early February.
Great, thank you. Not seeing any other questions right now, so I think we can go ahead and wrap up. If anybody out there does find that they have a question later, I'm going to be emailing everybody, so just a reminder, keep your eye open for an email. You'll get the slides, which have the link to sign up if you'd like to participate in the program next year. I'll also send a reminder out to everybody who registered in March with that link. And again, this is recorded, so if you missed part of it or want to share it with friends and family, you'll have that link. And other than that, like I said, feel free when I email you, if you have any other questions, I can send them along to the panelists, and we will close it out for the evening. So on behalf of UVM Health Network, I'd like to thank you for watching tonight, and we hope you'll join us again in the future. Have a wonderful evening.